Okay, so I am here in the room with Mr. Carl Rogers. I had just finished my assessment and I'm going to get ready to call the doctor. So I'm calling the doctor. Hi, my name is Sarah. I am the registered nurse here taking care of Mr. Carl Rogers in room 148 at Fortis Hospital. I just wanted to give you an update and get some recommendations from you about Mr. Carl Rogers here. He is a 67-year-old African-American male. He presented to my office today complaining of increased blood glucose levels for the past couple of weeks in the mid 300s. I did ask him and he said that he usually runs about in the 100, 120s, but for the past couple of weeks it's been really high. And he did come in with a non-healing wound on his right heel as well, and he said that he noticed that approximately 3 weeks ago. Some past medical history: he has been diagnosed with diabetes for about 20 years, and he has been insulin dependent. So last time I checked, he did have an A1C test done 3 months ago, and his reading was 5.2%, but looking at his labs now that we had drawn up, his A1C is now at a 7.5, which is a little concerning, probably from the uncontrolled diabetes that he's been trying to manage himself at home. He denies any significant previous illnesses, but he did have a transurethral prostate resection about 5 years ago. Just going over some of my assessment, looking at his wound was the most concerning thing. He had a 1.25 by 1.25 wound on his right heel. It had purulent drainage coming from it, so it kind of indicates maybe a little bit of an infection. His white blood cells don't indicate that, but he did complain of increased pain. His pain scale, or his pain level, was a 3 out of 10 on his right heel, and he did state to me that he could use a little bit more pain medication to make that go away and to kind of help him sleep. He said that he hasn't really been sleeping from the pain, and touch makes it worse. We do have an order for a sterile wound dressing change in a little bit, so I would recommend maybe increasing his morphine. He does have the medication scheduled, PRN, for 2 milligrams, but his pain is pretty bad, and he said that he could use something more, so I would recommend maybe increasing the morphine to 4 milligrams before we do that sterile dressing change. Also, going over some of my assessment, he did have a productive cough. It was white and frothy and thin. He was coughing up about 5 milliliters, and I did notice that on his chart he's receiving lisinopril, and I'm just wondering if we could maybe switch that medication over to something different. It could just be the medication could be causing him to have that cough, so if we could get that switched over, I would recommend that as well. And then maybe we could do a culture and sensitivity test on the wound. It is purulent drainage that is draining from the wound, so maybe we could rule out infection and get on top of that if he is showing signs of infection later down the road. So I'm going to repeat the orders back to you. So we are going to hold the lisinopril for his next dose. Okay. And then we're also going to increase the morphine to 4 milligrams. And we're gonna give that to him on his next dose before the dressing change. Okay, so I'm gonna read this back to you. So we are going to hold the next dose of lisinopril, and then we're going to increase the morphine to 4 milligrams for his next dose. Okay.